Airlift 2, scene response. Bainbridge Island.
Airlift 5, go ahead. All right, no problem. We'll be coming out of Seattle. We'll be there in about 15 to 20 minutes.
Over mountains,
Airlift 2, 12:30.
onto islands, into the middle of highways. Wherever we are needed, Airlift Northwest is there. Since 1982, we've expanded our fleet, our staffing, and our reach. Now, 3,800 patients a year in the Pacific Northwest and Southeast Alaska are transported in our airborne intensive care units. With one call, critical care nurses, equipment, blood products, and medications fly to the rescue to make sure the worst moment of a patient's life isn't their last. 35 years ago, on a rainy Saturday in Sitka, Alaska, this wasn't an option. Dr. Michael Kopis, the director of Harborview Medical Center in Seattle, sat in a local community hospital with 3 children pulled from a house fire and a desperate need to get them to his Level 1 trauma center in Washington.
So I spent the entirety of the afternoon, usually from about 2 o'clock until 4 o'clock, calling every fixed base operation.
He eventually found a pilot and plane, but the children didn't make it to Seattle. That day, Dr. Kopis found a mission.
And I decided from all that afternoon of sitting and dialing and talking to a variety of, I'm sorry you reached the wrong number, and wait 5 minutes and listening to elevator music. No doctor should have to. They ought to be able to pick up a phone and get the help that they need.
The region's first critical care air ambulance service was born. In its infancy, Dr. Kopis was a one-man dispatch center.
I kept with me a 3x5 card with phone numbers of every fire department, every hospital, and many of the doctors in Southeast Alaska and elsewhere. Because when they paged me, I would call the fire department and say, Airlift is coming. Can you meet us at the airfield? And I would call their hospital and find out where the patient was and whatever the actual problems were, so I could tell the nurses. And then the nurses would call me. I carried around a brick, a large phone, the kind that was about as big as 2 hands, which I had to hold with 2 hands. I had a long aerial, which Lou had given me for Christmas.
Then the nurses would rush to the airfield.
They would gather at the airfield. Hopefully they gathered in a rate which did not acquire tickets. One of them, who was a bit of an aggressive young lady, drove her Volkswagen, which was a little souped up, as aggressively as she could, managed to get at least 2 tickets responding to Airlift when she was working.
Over the years, that kind of passion kept the mission moving. Innovation, commitment to excellence, and a whole lot of hard work forged Airlift Northwest into the force it is today. 35 years in, ask Dr. Kopis what makes him most proud. It's the people.
I'm most proud of the nurses who learned and did, and were not afraid to fly. Yeah, it takes a lot of guts to fly.
140, 210.
I think somebody needs to thank the families for giving them up for that period of time they did. Thanks for buying into the program.
So we pause for a moment to look back and celebrate 35 years, more than 100,000 critical patients, and one man's vision that helped make it so. And we look ahead to bring the best care possible to the patients who don't yet know they'll need us. Thanks to all those who believed in and built Airlift Northwest, we'll be there.